Okay. First of all, I would like to thank everyone for joining our COVID Pediatric webinar hosted by the Asian Youth Center and PACS Asian Counseling Service. My name is Angela, pronouns she, hers, hers. Today I have Josh and Alexis here with me, and we are all part of the Asian Youth Center, which is a nonprofit organization that aims to help low-income families, immigrants, and at-risk youth. Next, I will have PACS introduce themselves and the team.
Can you make Myron co-host, please?
Oh, can you do it? I thought I made you co-host.
I can't do it.
You can? Wait, hold up. That means I have to stop sharing. Sorry, give me 1 minute. Oh. Sorry about that, Myron.
No worries. All right. Hey, good morning, everyone. Glad everyone could be here to join us for today's webinar. Many thanks to Dr. Tan for sharing your wisdom with us for the upcoming hour or so. I'm Myron Kwan. I'm the Executive Director at Pacific Asian Counseling Services. And again, some of my team members are here who are working on the COVID pediatric vaccine project that would include Richard San, Satya San, Kiri Cha, and not last or least, Violeta Villarreal is also here. So has been working on this work. So thanks to everyone for joining. And yeah, I just wanted to do a quick shout out to the rest of my PACS team members.
Thank you, Myron. Today we'll be going through some information on different types of infectious diseases and vaccination, along with how to talk to parents about getting their children vaccinated. We will also have a Q&A section after. Please feel free to type your questions in the chat and we will address them at the end. We have a guest speaker today, Dr. Song Tan. He's a pediatrician from Long Beach who has been practicing medicine for over 35 years, including his time in Cambodia. Being a sole survivor of his family in Cambodia genocide, he escaped to Thailand refugee camp and started his new life in the US in 1980. Dr. Tan established a Cambodian Health Professional Association of America to serve the community and deliver free healthcare and medications to the disadvantaged people back in Cambodia. He served as a mentor, instructor, preceptor, as well as numerous community boards, and was elected as chair of the pediatric department of both Miller Children's Hospital and St. Mary's Medical Center. Please give a warm welcome to Dr. Tan. Now I will turn the mic to Dr. Tan so he can start his presentation.
Thank you, Angela, for the introduction. And thank you for the organizer of the Asian Youth Center and the PAC, Pacific Asian Counseling Services. I apologize, I didn't put AYS there because I didn't know AYC. I didn't understand that it's co-organized by both. I thought it was a PAC alone because I contacted with Richard. Thank you, Richard and Alex, who have been contacting me about this talk today. Today's talk is from the perspective of a community pediatrician like myself that have been involved in the care of still practicing in the communities in Long Beach. So the perspective from a community pediatrician, it differs from an academic pediatrician or some kind of scientist. So I just want to share some of my experience with you in the care of everyday practice with children. So let's start. And Angela, you have to help me move the slide. Yes. Today, I'd like to review a little bit about the history of the pandemics, some vaccination and the current practices of vaccination, and the current tripodemic, which is affecting our community and our country actually at this moment. Next, please. Pandemic is not the first time we went through this. It's throughout the history we went through. We didn't live to see that, but in the history, you see the plague was one of the biggest pandemic in the pre-historical time in BC 430, and the Black Death killing more people than we can imagine, 200 million people And I believe that the plague was originated from Canaan, from one continent to the others, from Asia to Europe. It takes many, many years in order to do that. Versus nowadays, it takes a few days or maybe hours from one point of the earth to the others. So it's a different problem because we live very closely together right now as we share the same world. Okay, every day, so many airplanes travel from one point to the others. Versus the past, they had to go with the weather. No people can carry the germ, animal, insects, in order from one continent. It takes many years or decades to go around. The next pandemic that we knew was smallpox that was very deadly. And you know, a lot of Native American was very they call virgin, or they didn't have this thing, and it was brought in by the European to the Americas. So a lot of American were exposed, Indian American, Native American were exposed and died. And the next, the big one is one in the century. Spanish flu was occurring in 1918 to 20. That was mentioned when we have this current pandemic. We compared to the Spanish flu that also killed a lot of people. And the next one, HIV/AIDS, we had a recent in the 40 years ago, you can see. And you have the SARS in 2002, mostly in Asia, and the MERS, Middle East, and the swine flu, Ebola, Zika, more recent, and COVID-19. Now, the future, it was WHO had predicted 2018 that there's going to be a disease X, and it happened to COVID-19, which is declared a pandemic in March 11, 2020. So it's not a matter of if, but a matter of when the next pandemic gonna come again. So we had to get prepared to cope with any eventuality in the future. Thank you. Next one. So you see the plague, you see transmitted by rats and flies, and you kill a lot of people. And those some of the images are awful, horrible pictures. Next. So many people die, you see depicted. And this smallpox, more recent, we have smallpox. They were eradicated in 1978 to 79 from the surface of the earth. We have not seen any smallpox since then. Next. See some of the awful picture. And this is a Spanish flu. You see, in the turn of the century, 20th century, people just have to be admitted to the ward. And already at that time, we have measure of face mask, masking. And the history itself, some community who refuse to mask have higher incidents, higher cases of stomach flu. Those who mask themselves have less of cases. Next. This is a more recent, the HIV, the pioneer, and the one that associated with our pandemic is Dr. Fauci, a well-respected epidemiologist and doctors. The HIV is really just the main scientist that have been involved since at that time. So almost 40 years ago, he had been involved with HIV/AIDS. Next. You see, HIV is also a very awful disease that affects millions of people and still going. Luckily, HIV have a treatment. There's no vaccine, but there's still treatment, and people get to live longer and have. The most famous is like Magic Johnson, who at the time is like sentenced to death, but he's still alive and healthy, owing to the medication, the miracle of modern medicine. Next. Next, we have the SARS in 2002, affecting mostly Asia, Hong Kong, China, Hong Kong, and the East Asian countries. And that was very short-lived because, the case is not that infectious. Next. The MERS is a Middle East respiratory syndrome, also caused by a coronavirus, MERS-CoV. Okay, next. We have Ebola in West Africa mostly, and have seen in our country a few years ago. Actually, one Vietnamese nurse, Vietnamese American nurse, actually affected, and very people are very touched by this pandemic. Next. People thinking of Zika is from South America and affecting the children that was born, and then they suffer. They call microcephaly and developmental delay, and those are affected by flies. And you still had to be aware of Zika virus, that but have not heard much from them. Next. So I mentioned about any emerging disease in the future, we have to be prepared because of different factor, encroachment on the nature because of global warming as well, population growth. So we encroach in the environment, so the animal get closer to us, and so they can be carried by bats, most likely, because bats are mammal that are very strong, have a very strong immune system, and they carry many viruses that pass on to other animal, and animal can carry and pass on to human, which is the case of SARS and maybe of this COVID-19. Next. So the measure for the pandemic, I have some character. The first measure before anything else is the quarantine to separate people, to isolate. And next is testing and tracing and to isolate. That's what each Asian country did in the beginning, which is very successful. And the other very effective measure is social distancing and masking. Next. I'd like to talk about a little bit about vaccination, briefly go over vaccination. Let's next. The vaccination originated from Dr. Edward Jenner that performed his first vaccination in a boy at this, and people, and this is for smallpox. They discover that people who work with cows and they get the pox and they can be resistant or can be protected from smallpox. So Dr. Jenner applied this his knowledge to practice and practice. The first boy who did it, his name is James Philip. Next. Any one of you remember when I was young, I have still my scar to prove it, that we have a scar as a result of the smallpox vaccination. They introduce the vaccine. It's a small drop of liquid to some scratches on the skin with a needle. Next. And then the result in the scar. I still, people older like myself can see the scar of the smallpox vaccine. But as I mentioned about, smallpox has been eradicated from the surface of the earth, so no more vaccine for these diseases. Next. So that's all. I'd like to talk about, this is a BCG, it's a vaccination versus a smallpox, it's different. You can see myself, I have that as well. I have that BCG and also the smallpox on my left arm. So once in a while, I saw the NBA player when they have a scar on the upper left and they're young like that, it's a BCG. BCG has been practiced in other countries besides America to protect against TB. So you don't see people who born here get this scar, only foreign born. You see that scar, that means they are born in other country. Next. So that's some of the picture of the awful smallpox again. Okay, and this is vaccinated and non-vaccinated. So what's the difference? You know, vaccination works. That's what improved. Next. So I'd like to go over the current child vaccination practicing here in our country, in of course in over the world. Next. Okay, next. I have this booklet, and you cannot see. It's in the here. The date is January 1997, 25 years ago. The California Public Health Department make this video, involve myself and the family. You know, this Kawadi's sister, right? You know, anybody knows the family. They all grown up now, over 25 years ago. And I have this video for the Hmong, for the Lao. They translate into languages. Next. And here at that time, that's how many vaccines you have. Very few vaccine 25 years ago as compared to this one. Next. The current schedule for immunization is so many more. You know, first you have hepatitis B, you have DTP, IPV, which is polio. I'm gonna mention in detail next. And you have meningitis, pneumococcal. Of course, you have chickenpox beside measles, and then later on you have the Tdap, which is after 11 years old. Next. So here the list of vaccination. They currently, like I said, BCG is not currently practiced in America, but in Mexico, they used to have it. People, immigrant from Mexico, you see, they have BCG. We give rotavirus, which is a oral vaccine that to protect one of the very, very severe viruses that cause gastroenteritis, stomach flu with diarrhea and dehydration. Hepatitis B or the Asian, a lot of Cambodian, Chinese, Korean, Vietnamese also have a lot of hepatitis B. So the children who get, who born to parents who carry the virus have to get the hepatitis vaccine to get protected. You have the DTP, which is diphtheria, tetanus, and whooping cough. Polio, which is a disease almost extinct from this world. There's only 3 countries in the world that still has it, which is Pakistan, Afghanistan, and Nigeria. Because other countries have a hard time reaching to the rural area because of religion. They said this causes sterility to the country, so they have a lot of resistance. Hip is a meningitis, and pneumococcal is another bacteria that causes meningitis as well. So you have measles, chickenpox. This MCV is a meningococcal disease. When you are, some of you younger, when you go to the dorm in the university, they require you to get this, they call Menectra shot when you go. And here, MMV is another kind of meningococcal vaccine that cover some of the subtype. And HPV is human papillomavirus. The girls or lady who born now after the advent of this vaccine, they're gonna go on to have less cervical cancer. This is a virus that causes cancer of the cervical cancer, and also oral neck cancer for boys, and of course influenza and COVID-19 vaccine. Next. So you can see hepatitis B in our community. We lost so many people in our community, Cambodian community, I know, and also Chinese and Vietnamese. A lot have this is end stage hepatitis B, and they're gonna have cirrhosis and liver cancer. You heard probably some of your relatives, probably in the Asian, East Asian country, you heard a lot of hepatitis B. That cause fatal, very fatal. Okay, next. Yeah, diphtheria is you never seen, nobody almost seen one case. I never seen one case in America, but in Cambodia, there's still a lot of cases in the past before the advent. You have fever and you have all the throat, the tonsil covered with white plaque. They call diphtheria, very, very severe, very deadly, almost fertility rate is very high. Next, tetanus, of course, everybody heard about tetanus. When you have cut, you go to the emergency room and they give you, they have to have vaccine. Do you have when's the last tetanus shot? So everybody should be aware, should get this, okay? We always have cut here and there, everybody, you know, myself included, right? We are active. Okay, next. See, whooping cough. Whooping cough is a cough. In Chinese, they call 100 days cough. And in French, they call coqueluche, which is the word from Khmer is from the French, because the typical cough, like the cock, that's the cock singing. And that in American, they sound like whooping the sound, whooping sound. That's why whooping cough. And Cambodian, they call cough of the chicken, because that translates from the French. And in Chinese, 100-day cough, and that's really real. Have been known since history in 1,000 years ago. This is not, there's a vaccine, but there's no cure. Okay, next. So polio. Polio is almost extinct. Like I said, there's no cases here in America. I think there's one case in immigrant in the last few months from some imported. So we don't see it, and we still give the vaccine. However, because when there's one case is in anywhere in the world, we still have to be mindful that it can come anytime to our country. Okay, so that's why we still continue to practice vaccination to give to our children. We still see some older people have this. My friend, he from Taiwan, he had polio, and he's an oral surgeon here in the community. He had polio as well. Okay, next. The famous person in the world, in the history of polio is Franklin Delano Roosevelt. Okay, just to let you know. Next. Here's a hip. It's a bacteria that can cause a severe infection on the eye. It can go to the eye. And here represent the swelling of the brain or meningitis. Next. After the advent, I saw this almost once a week during my residency. After this vaccine was available, I have never seen one. So that proved that vaccine works very well. Chickenpox. Have you seen any chickenpox lately? Probably not. In the past, we've seen almost every week, every month, okay? And they had chickenpox party. Because when you get chickenpox in the young age, you have less complication. Whereas when you're adult, you're gonna have more severe complication, pneumonia or infection. So people at the time go on to have party, want their kid to be exposed so that they can catch it and get over with it, so that they don't have, you know, the chickenpox later on, no chance to catch it. But nowadays, since there's a vaccine, we never seen any chickenpox. Rarely you see any chickenpox. Next. And think about the consequences when later you're gonna have shingle. Measles is very common, and you heard about measles because of the hesitancy of vaccination. Sometime in Europe, there's one in Disneyland, they bring over because of this hesitancy and lack of vaccination. Measles is very common. Everybody get it, very contagious. Very, when they mention about COVID, some they compare, you know, to the Delta, almost to measles. Measles, you can be in a room together within many hours later, you still can catch measles. So during my childhood time, the community, the village all get it and have 10% complication rate. 10 complication, they have pneumonia, so sometimes encephalitis, and it's very severe. So it's better not to get it. So owing to the vaccine, thanks to the vaccine, we don't see measles so much. But because of this less herd immunity because of vaccination rate decrease in some European country, measles have been come back. So it's very bad that we have to live through that if everybody just get vaccinated too. Okay, next. This is moms. Moms, it's just show you it's not that serious when you get sick, but complication is infertility or sometimes pancreatitis. Next. German measles. German measles actually is a very mild disease with fever and rash, but then later on, if you a pregnant woman get it, it can cause the baby to get a disability. So, you know, blindness, mental retardation, cataract, blindness, and sometimes can have serious illness. Next. Here is a meningococcal. It's very awful. You heard the news. Sometimes college student or adolescent, high school student have fever and they die in one day, and that's because of a meningococcal. So there's some new reports sometimes. And sometimes have slough off because it's here, the foot is problem. I have a patient, the nose was slough off, no more nose because it cut off the bacteria, actually infected and cut off circulation. This person gonna have their toe amputated, just like, you know, frostbite, some frostbite that gangrene, you cannot save no more. Next. So a few only very in passing, not neglect the adult. I'm a senior citizen as well. Next, we have to be mindful of this child. I think very complicated. Let's go next. Everybody had to get hepatitis B, especially Asian ancestry. Check your hepatitis B or C status. Everybody should do that. Next. Everybody should single shot, adult, single shot, because it's very painful, very miserable. And of course, Tdap, tetanus, and also flu vaccine. Next. So we have, I think, I don't know my time. I want to address some of the current epidemic. Epidemic, which is consists of the three conversion of the three viruses we're living through in the last almost 3 years. COVID-19, but influenza has been there every day, every year since history. And you remember the pandemic, the salmon flu in 1918. And currently in the pediatric population, RSV, which is respiratory syncytial virus, affecting us so much. In the news every day right now. Next. This all is confluent of this, just repeating myself. Next. Influenza. Influenza is a virus that occurring mostly in the summer, but this year it's going to be bad because what happened in Australia is a harbinger to what's going to happen here in us. Just like COVID, you know, European happened first and then come to America. So it's an influenza virus consists of A and B. I have a few already. So it's preventable. Although the vaccine is not always effective, 100%, maybe 60, some year 25, 50%. It's not 100% effective, but they can prevent serious illness and death. Influenza just give you miserable. If your immune system is strong, you just miserable, high fever, coughing, more than a common cold. And if there's a test, antigen test, they can do it in an emergency room or in some office. But there's a vaccine. Everybody should get the vaccine. You know, I already got mine. So the hospital, staff, everybody require mandatory to get the vaccine. If not, you're not gonna go to the hospital. And there's a treatment. As long as you talk to the doctor within 48 hours, they have a vaccine called Tamiflu that can ward off and alleviate the symptom. Next. Respiratory syncytial virus is to detail. This is on pathology. They can detect it very easily as well. It's a virus that affects anybody, but the most important thing is that affecting the younger children, especially less than 1 year old, the most common, but the less than 6 months old, the most commonly is the most sickest and require admission to the hospital. So respiratory syncytial virus has been around so long as well. There's no vaccine. You heard the news that gonna have one vaccine very soon, but you know the jury is still out. We're not sure. Scientists have been trying to get a vaccine for many years, but there's no no luck. But RSV, there's a prevention by giving they call monoclonal antibody. The name is palivizumab, and that usually have criteria as what population, what kind of children. Usually children, premature babies, less than 1 year old, 29 weeks or below, and some have a congenital heart disease or chronic lung disease. And the shot costs so much. I was one time I give it to my office, and usually they give it in November because that's the most common season, November to May. But this year, RSV occurs since September. You know, we only in November, and we already have the peak, almost so many. You see the news, you just Google and RSV everywhere, 1,000, 200, 500, I think many fold increase since the year before. So that's why the children hospital fill up with patient and even spill over in other area. Next. Okay, we just everybody know COVID-19 was identified in Wuhan, China. We declare as an emergency of international concern in January and did not declare as a pandemic until March 11, 2021. I think 2020, this is a mistake, 2020. Okay, next. See, this virus look like, have some spike. Next, I think show the structure of the virus. The spike, that's where the vaccine or target. It's the spike, you have the membrane and the nucleus capside inside. Next, it's the RNA virus. And the problem with the COVID is we have variant. This is the slide from last year. Last summer, we had the Delta, which is very, very contagious. And it caused a surge, second surge or third surge of COVID vaccine. Next. Nowadays, we have the Omicron variant, which is a BA4, BA5, and there's more variant coming. It's when it comes to COVID, it's an evolving thing. Oh my God, it keeps changing all the time, you know. So nowadays, we have more variant that's cited in Singapore, and also in Europe, and we just have to brace for the next wave of variants. But luckily, the vaccine is still working, so everybody should get vaccinated. Next. Similarly, the symptom was cold, a flu, and a COVID. Usually, they have commonly, the most common thing, fever, chill, headache, cough, muscle ache, fatigue, vomiting, diarrhea. And shortness of breath, of course, that's a red flag. Runny nose, everybody say sore throat, but the feature that is more indicative of COVID is loss of taste and smell, which doesn't exist in the flu. Next. Symptom RSV, kids would present with fever, runny nose, cough, and of course, if the patient, the baby have increased respiratory effort, I mean, breathing fast, tachypnea, that means the respiratory rate going faster than normal, wheezing, crackle, that means the chest, then the doctor listen by stethoscope to the lung, there's some moist sound that indicates some inflammation. Intercostal and subcostal retraction, that means you see the chest kind of pulling up and down, and grunting, making noises, and the nose actually flaring, that means, you know, kind of moving because of sucking air in babies. And lethargy, irritability, and poor feeding. Baby get tired and crying and upset and don't want to eat. Next. Next. So I want to go over they call upper respiratory tract infection and lower respiratory infection. Like, as I mentioned, bronchiolitis and pneumonia, most common in the first year of life, and most hospitalization in the first 6 months. I want to let you know about this. Next slide. You know, when you go to the doctor, next slide, please. When you say, they say you have a cold, A cold, basically URI or URTI, upper respiratory infection, that is, you have only the upper respiratory tract, the nose, okay, the bronchus, and then big branch, they call upper respiratory. When they call lower respiratory tract infection, that means gonna affect the bronchiole, the small, the end of the bronchial trees and the capillary. And that's called pneumonia when you have infection. So distinction is that upper respiratory infection is not very severe. It's a mild cold, it's a mild. When you get lower respiratory infection that involve the lung, then you probably have some kind of shortness of breath because your lung capacity is decreased. You know, you cannot breathe, your lung cannot function as well as before. So lower respiratory infection, usually doctors say pneumonia or bronchiolitis. Next. Okay, so there's a prevention. This is a slide last year, as of last year was the most common vaccine available. In America, we have Pfizer, Moderna, Johnson, and we have the next one, next slide. Next slide. Okay, Moderna, Janssen, next. Novavax. We have the current vaccine in the US, we have Pfizer, Moderna, which is mRNA vaccine, Novavax, which is just approved, or you know, the EUA, they call emergency use authorization, and Janssen, the only 4 vaccines available. But the most commonly used is Pfizer. The most have been given Pfizer, followed by Moderna. Next. I'd like to see Pfizer is a vaccine that widely used all over the world, billions of doses. So we have the most experience. And that's the one I picked to use my office, also more for pediatrics. So we have 3 vaccines now available, you know, in the primary series from 6 months to 4 years, which consists of 3 doses. Dose 1 to dose 2, you have to wait 3 to 8 weeks. Those 2 to those 3, more than 8 weeks. So we have the second one for pediatric. The first one they call infant and toddler. The second one for pediatric, which is 5 to 11 years old, consists of 2 doses. And then you have the third, 12 years and older one, which consists of 2 doses. Next. Now we have the bivalent, I think next, yeah, bivalent booster, which is the updated Omicron specific one. It was available since September. And now we have, in the beginning, you have from 12 years and older, but now we have from 5 years and older. So two kind of Pfizer bivalent. And Moderna also have this as well. This vaccine covers the ancestral strain and also the Omicron subvariant BA. Everybody is eligible if you have the primary series and had 2 months has passed since the last completion of the primary series of the booster vaccination, regardless. Now we don't use the original vaccine as a booster no more. Anybody should get the bivalent or updated Omicron specific booster. So everybody should get that one as long as you are 5 years and above. Which is only approved for this age. Next. Local side effect, and you've been through this, everybody have this, those who had that have experienced that kind of local pain, a little bit swelling, and some are lucky enough don't have other things like fatigue, headache, muscle pain. You know, it can last a few days. You just have to take some Tylenol, you know, and that's gonna go over with it. So a lot of people, very few have severe side effects like myocarditis reported, especially in the young people, 18 to 45 years old, and thromboembolic, that means blood clot, especially associated with the Janssen, especially young women, and some Guillain-Barré syndrome. Guillain-Barré is a paralysis of your legs, sometimes very rare. So 1 in 1 million, something like that, you know, which is very rare. And I don't know, there's so many, some side effect, this has been magnified, has been like that, and that led to a lot of hesitancy, not acceptance. Next.
Dr. Tan, I just want to let you know that you're 4 minutes in, so
Okay.
to leave some time for some Q&A, okay? Thank you.
Okay, okay. Thank you. Next. Okay. So I want to address some very big problem right now in our country, vaccine hesitancy. You know, this information, 65% of the anti-vaccine misinformation come from 12 doctors. They're supposedly doctors, you know, and the myth of the COVID vaccine is they always say in a misinformation world, they are not well tested, just like the current booster, they said not well tested, the bivalent. So a lot of people don't want to get that booster. So so far, not too many people get the bivalent booster, which is very sad, because they say, oh, it's not being tested. But the flu vaccine every year, we don't have that test, don't go to the test too, because when you test it in clinical testing, it's going to be too late. So it become irrelevant. So another point is that technology is too new, mRNA, then there's other vaccine as well. And why? I already get the some of my friends get the vaccine and they still have that. Okay, and it can affect the fertility. Oh, I already have COVID, I don't need the vaccine. A lot of my patients say that, you know. And children, oh, my kid not too sick, I don't want to get it. Okay, and oh, the vaccine causes a lot of death, thing like that. Or some even allege that Bill Gates implanted a microchip in the vaccine, which is ridiculous. Next. So challenging is that people don't trust science no more. Science become a bad word, you know. So it's have to get the community, the social adaptation, and there's some clash between idealistic value and common values. You know, in America, right, and in Asia, you compare the social acceptance of mass, and it's so different. The mandate, vaccine mandate, those become very, bad word, mandate. Scapegoating, we suffer we have been receiving some, hate crime in the Asian community, and also the political climate in our country of polarization and tribalism is now a big problem in our country. Next, almost. So what should we combat social media? A lot of us Americans get the news from social media. A lot of misinformation out there. And of course, our healthcare provider, we are the most trusted, right? I hope so, especially when it comes to health information. If we don't help to dispel all this information, who will? Next. So when we talk to the patient, we don't want to talk about like vaccination. We say vaccination, but not injection. Some of the tips, I have to say, a safe and effective vaccine, not that all the vaccine was very quickly developed, okay? Authorized by the FDA, instead to say that on clinical testing, instead by approved by the FDA, get the latest information instead of there are things we still don't know. Keep your family safe. No, don't say keep our country. It's not. When the family strike more close to home. Public health instead of a government. Talk about medical expert instead of scientists. Scientists is gonna be a bad word. Next. So I want to tell you about the Swiss cheese concept. This had been, I think, promoted 20 years ago to deal with risk accident prevention in the hospital. So many layers, not one single layer is effective. Only all the layers are important. Each layer is not perfect, right? So the Swiss cheese concept. Next. When applied to COVID-19, wear a mask. It doesn't help all the time, but it helps some. Wash your hand, social distancing, cleaning any surfaces, get avoid large gathering, and open the window can help. Next. See, this is a specific concept in the time of pandemic. Some are personal responsibility, some everybody share responsibility. Personal social distancing, mask, hand hygiene, avoid touching, and limit limit your time. And some social share responsibility. Okay, testing, government messaging, quarantine, and vaccine. You protect yourself, also you protect the community and the country, right? Next. So get vaccinated. This is a reverse psychology. Don't get if you want to come to my funeral home. Next. I think that's all. Thank you, and let's appreciate your time. Thank you. Get vaccinated and to protect your family and yourself.
Thank you, Dr. Tan, for all the wonderful information. Now we will take this time for anyone who has any questions. Feel free to put in the chat. And let me see, let me stop sharing. Stop sharing. Okay.
Hi, I have a question for Dr. Tan. Can toddlers get the COVID-19 vaccine?
Yeah, I mentioned about 6 months, from 6 months old up. The problem, nowadays, the 6-month-old the infant and toddler, over the country, only 8% get it. I talked to my patient, they're really reluctant to get this shot, more than the older kid. I don't know. This is a problem for us. A lot of parents just feel afraid for the children. They love their kids, of course. And this has been a spillover effect on flu vaccine as well. Last year we have more acceptance, and last year the flu actually didn't affect us too much. And there's not so much flu because of masking. So vaccination last year worthless actually. But this year, because the threat of the triple pandemic, a lot of parents don't want flu vaccine as well because of they're reluctant to get pandemic. I think this is a bad situation right now. The flu gonna be so bad soon. I have already had patient very unusual with flu, besides COVID. Okay. So of course, 6 months and up are eligible to get all the COVID vaccine.
Thank you, Dr. Tan. I just want to say thanks for being here and all of the information. It's been very helpful.
I think I tried unmuting you, Alfredo. Okay.
Oh. Dr. Tan, I had a question about the booster, the second booster. They say it's good to have these side effects, the fever, body aches, headaches. Why is that? Why is it that it's a good thing that you have those side effects when you have a second booster?
Actually, now we don't give this booster, we just give the bivalent, okay? I have 2 booster. I have 2 primary series from Pfizer, 2 booster, and I just got the bivalent. Anybody regardless of a bivalent of any shot, as long as you have the primary series, you get the last booster bivalent. That's it. Okay. So the one before are not authorized to give as a booster no more. Okay. So to your question, I don't know. I don't think that's any correlation between good or bad, but just, you get it. That means you don't get placebo water. That's all, you get the real vaccine. You have some local tenderness, redness. That's common. I have the first and get a little bit sore and chill. The second one a little bit chill. But when I get the booster, just not too much except local tenderness, you know. So I don't think that correlates with the protection or not protection. I don't see any relationship. You get it, that's it. Some you get some more side effects, some less. It depends.
Hi, Dr. Tan. There's also a question in the chat asking if they got their last booster of Moderna, should they get the bivalent as well?
Yeah, bivalent, they can get it as long as 2 months have passed. And now we can get even, they call mix and match. If you get Moderna before, you can get Pfizer, you can get Moderna. Only Moderna and Pfizer have the bivalent booster. So as long as 2 months have passed since the primary series or since the last booster. If your patient get, say, the booster in the late September, most likely they have the bivalent because it's already after the available. If they get it in August, probably that's too bad. They get still the old booster. Then they have to wait till 2 months, which is October now, you know. So this is the booster, the bivalent to cover the Omicron, the newest variants. But the original, the primary series or the old booster is the same thing, the same vaccine actually. Those are covered for the ancestral strain of COVID virus. That's all. Don't cover. So it's not really as effective as you have the bivalent booster. So everybody should get it because so far not too many people get it according to statistics. Everybody should urge their friend, family to get it, to be ready for the surge, for the spike in the next month or next weeks, you know.
Let me see. I think I tried unmuting you, Richard. But
yes, I got it. Dr. Song, thank you so much for coming. Dr. Tan Song, I keep calling the first name and last name. Thank you for coming. And I just want to thank for your language tips, because this is makes sense, because you know, something that we should say, like a vaccination instead of injection. So I make sure that my staff and I is going to practice this from now on, because this is the thing that we didn't pay my attention. No wonder why when we talk to parents, they concern, and this is a great tip. Thank you so much.
I know, me too. I'm learning too. We learn as we go, you know. We try to improve ourselves.
Okay. Well, it's 10:59. I just want to do a quick update on upcoming events real quick before we go. That AYC is hosting a health fair event on December 3rd. We'll be offering free COVID-19 and flu shots to adults and children. There'll also be activities and food. Everyone is welcome. Excuse me, sorry. Everyone's welcome to join for the holiday festivities. Is there any questions regarding like events or anything? If not, or you can type it in the chat. Okay, well, I mean, if not, then we would like to take this time to thank everyone who has joined this webinar, and special thanks to Dr. Tan. This webinar wouldn't have been a success without you. We hope everyone stays safe and has a great weekend, okay? Thank you.
Thank you for inviting.
Oh, thank you, Christine.
Thank you.
Bye, everyone.